Basic life support, BLS, is a critical set of actions that can be taken to support the circulatory and respiratory functions of a person in cardiac arrest or respiratory failure. BLS is often administered by bystanders or first responders until professional medical help arrives. Here's a detailed step-by-step procedure for basic life support. Ensure scene safety. Before approaching the victim, make sure the surrounding environment is safe for both the rescuer and the victim. Check responsiveness. Tap the person and shout loudly, "Are you okay?" to check for responsiveness. Activate emergency medical services, EMS. If the person is unresponsive, immediately call for help by activating EMS. If someone is nearby, ask them to call while you proceed with the next steps. Check for normal breathing no more than 10 seconds. Look for signs of normal breathing and check for a pulse at the same time. Use the carotid artery for no more than 10 seconds. Check for chest rise and fall, and listen for breathing sounds. If the person is not breathing normally, start CPR. If a person is unresponsive and not breathing normally, begin CPR immediately without checking for a pulse. The emphasis is on starting chest compressions early to maintain blood circulation. Begin chest compressions. Place the heel of one hand on the center of the chest, just below the nipple line. Place the other hand on top of the first hand and interlock the fingers. Position yourself with your shoulders directly above your hands, and keep your elbows straight. Use your upper body weight to compress the chest at least 2 inches, 5 centimeters, deep at a rate of 100,120 compressions per minute. Allow the chest to fully recoil between compressions. Provide rescue breaths. After 30 compressions, give 2 rescue breaths for adults and children. 15 compressions and 2 breaths for infants. Ensure an effective seal by pinching the nose shut and covering the person's mouth with yours. Each breath should last about 1 second and make the chest rise visibly. Continue CPR. Continue the cycle of 30 chest compressions, followed by 2 rescue breaths. Minimize interruptions in chest compressions to maintain circulation. Use an automated external defibrillator, AED, if available. If an AED is available, follow the device's prompts and attach the pads to the person's chest as soon as possible. Continue BLS until professional help arrives. Continue CPR until the person starts breathing on their own, emergency medical personnel arrive, or you are too exhausted to continue. Remember, BLS guidelines may be updated, so it's essential to stay informed about the latest recommendations from organizations like the American Heart Association or the relevant authority in your region. Additionally, consider taking a BLS certification course for hands-on practice and up-to-date information with CPR Management Inc. Let's help save a life one victim at a time. See you in our next video, checking for scene safety.